Because a lot of it, you can read it in the textbook, you can study it, but until you practice it hands-on and be able to tie that experience and knowledge together, that's how you become wise. That's how you move from the novice to the expert nurse. And that part I am having the most fun with. I wanted to come in and give you all an update on where I've been, what I've been up to, and what's next for me. Today is December the 27th, so we are closing this year. We're closing this chapter, going into a new year and a new season. So fast forward to today, I'm going into the spring semester starting next month, and I'm going to continue with my program. I'm still wanting to complete this degree and still wanting to become a midwife. My goal is to graduate hopefully the end of 2023. I haven't come in and share and give you guys a lot of updates recently because honestly it hasn't been a lot to report. I haven't been in school the last 2 semesters. When my project fell through again, I kind of was just like, okay, we'll finish eventually. I'll get the degree eventually, and that's kind of where I'm at. The reason I'm at the position of not so much that I don't care, it happens when it happens. I really feel this season has been purposeful. It's weird because a lot of times we go through things and we're thinking that the redirection or the failures or not accomplishing things on a time frame of when we have set out to accomplish them, we take it as a loss and we take it as a setback. But honestly, this time around, I feel as though I'm right where I'm supposed to be. And I'll explain to you why. A lot of it has to do with my new job that I've been in. I started in May. So what is that? December made 7 months for me at my job. It all feels so purposeful for these reasons that I'm going to share. First off, for the last 7 months, I've been working as a labor and delivery nurse on a level 4 maternity unit. So our hospital is designated level 4, which is considered the higher risk, actually the highest level designation, where women go and they don't get transferred out. So basically working on a level 4 unit, women that come to us are typically sick. They come to our facility because they are in higher need of higher level of care. So we see a lot of women that are under the care of maternal fetal medicine, which means that they are high risk. So they are seeing high risk OB-GYNs. We don't have midwives at this facility. We don't have residents or students. So it's mainly OB-GYNs and again, maternal fetal medicine. So all of that, long story short, means we see the sickest of the sickest. Granted, we do have normal births, normal deliveries, but we are trained and prepared and staffed to see those high-risk patients. And I have been getting so much experience at this facility working with those high-risk patients. So that's the first thing I kind of want to talk about, which is the fact that this experience in the last 7 months, I believe, has really strengthened my confidence, strengthened my skills. I really feel more confident going into midwifery. Overall, I feel as though this experience is really just tying the pieces together. It's like everything is coming together for me, both the midwifery school and the didactics and clinicals, but also working with the women that I'm actually studying about. So actually the labor and delivery department that I worked in before going into midwifery was very low risk. We didn't have an OR. our women, they didn't come into really labor. It was mostly delivery. So it was mostly delivery, postpartum, newborn care, breastfeeding. I got all of that experience. But the laboring, when it comes to fetal monitoring, emergency cesareans, having to wheel our patients back and take them to the OR. So all of those things that I'm getting to learn and experience now on this unit, it really, I couldn't understand how much of a learning gap that I had until now. And I understand now the importance of having that experience before going into midwifery. Granted, not all midwives or student midwives are required to have that level of experience, but I do understand now how strong of a midwife student that it will make me. I do understand now the value of those skills and those experiences, because a lot of it, you can read it in the textbook, you can study it, but until you practice it hands-on and be able to tie that experience and knowledge together, that's how you become wise. That's how you move from the novice to the expert nurse. And that part I am having the most fun with. So I started that job in May. Again, it's been 7 months. And when I tell you the things that I'm reading in my book or have already studied and tested on, it is so rewarding to go in already having that knowledge, going into the rooms and educating my patients on certain things. But also I'm learning as I'm working, which is also pretty dope. I'll look up a lot of things and I'm like, that makes sense. I came off of preceptorship. So July 19th was my first day on my own without my preceptor. Of course, I still had them to reference. I'm never alone. My point is I always have someone, my charge nurses or other experienced nurses that can come in and just reassure me on some things if I have questions. But I've been on my own since July, and I have been able to help 34 women deliver their babies. The experience that I'm getting is amazing. So most of the cases are pretty vanilla. It can be your G1, never delivered, seamless delivery. But then we have cases that are pretty risky, very high risk, and there are complications, things that happen. I'm learning in situations why it's so important that we have those high-risk OB, why we have those maternal fetal medicine doctors, and just knowing your parameters, knowing your limits as a provider and when to refer. Just working in this environment in general, I'm gaining a ton of experience. So I'm looking at my phone and I have a couple of notes. I take notes with each of my delivery just to look back on a case and see patterns and just to kind of get an idea of what that woman was dealing with and how we treated some of her conditions. I'm getting a lot of experience with managing labor with Cervidil, Cytotec, Pitocin, all of those different medications to help induce and augment labor. So I'm looking at my notes here, and midwives, we don't work with a lot of these situations, especially when they're high risk. For example, one of my patients had anencephaly and IUGR, so there was some growth restrictions with the baby, and baby was not likely to survive out of the womb. Of course, we would refer that case to a high-risk provider. But there are situations that are unplanned, and you as the midwife have to be prepared for those situations, trained, and know how to proceed when you're having a complication. I'll give 2 examples. I had a patient who had a shoulder dystocia. So baby was stuck in the birth canal. Head was right there, but just could not deliver that head because the shoulder was stuck. I quickly, from my education and from my experience with Baylor, we ran through those scenarios in our checkoffs. So I knew instantly to go and grab a stool, help apply some suprapubic pressure and help get that baby out. And quickly, it was less than 30 seconds that we were able to get baby to deliver without any complications and no signs of any birth injuries, at least at the time of birth. And afterwards, the provider was like, very good job. She was just thanking me for helping her, for helping mom deliver a safe baby. And she did make one comment. She goes, that's why we don't deliver at home. And she doesn't know I'm a midwifery student. She doesn't know my background or education, but I was just like, yeah. But there will be situations where midwives will, have to think quick and provide care to the best of their ability, hoping to avoid a fetal demise or any other catastrophes dealing with mom or baby. Well, as the midwife, you have to know your limits. You know when to refer out, but again, there will be situations that are just unavoidable. Okay, so the other scenario that I had, I'm reading my phone here. This was back in October. So I had a lady, it was G1, who had gotten choreo. So she had been ruptured for too long, got an infection. She became septic. There was arrest of the active phase, so she was not dilating enough. She wasn't progressing quickly enough, and we needed to have a C-section. At that point, we had to call it, and she ended up needing a cesarean section. But again, there's going to be situations where you really just have to know your limits as a provider. But my main point of going through those scenarios is that with each shift that I come in and work, I'm always learning something, always being able to strengthen and hone my skills as a midwifery student, soon to be a practicing midwife. It's just a great environment for me to get all of those skills all at once. And I had a few nurses tell me that if you can work here for 1 year, it's equivalent to 4 years at some other facility or 7 years at a different facility. It can be very challenging. While I enjoy this facility, working at this hospital, and I'm learning a ton, there are days where I feel overwhelmed. I feel like it's a lot of work. Granted, I'm not averse to working hard. Always been, I guess I pride myself on being self-sufficient in any work position that I'm in, and being able to get the job done is something that I value within myself. But there are times where I'm like, this is too much. Do I really want to do this as a provider? Do I really want to take on this amount of responsibility and liability? It's just a lot. So much that I can go into in a different video. But that's where I've been, y'all. I've been working as a nurse. Again, I went from being full-time to now part-time so that I can go ahead and finish school. That's my goal. My goal is to complete midwifery school at the end of 2023. I'm on track to do so. If my project goes through and my project is accepted or is appropriate, so I'm trying to keep an open mind, trying to stay positive. But at this point, I'm just like, it'll happen when it's supposed to happen. Long as I'm doing my job, right? Doing what it takes on my end to ensure that I get the job done. But until then, I do, again, I enjoy making videos for you all and giving you content and information that I think is helpful, empowering and educating women. That's my goal on this channel. So school will finish when it finishes. I will finish school when I finish school. But in the meantime, yeah, I'm enjoying getting my experience as a labor and delivery nurse on a level 4 maternity unit, and I'm getting great valuable experience. It's helping me to become a future expert midwife. Whether I want to deliver babies in the future or not, that's a whole different story. But it's really helping me gain the confidence and skills that I need to succeed as a midwife. So I'm most excited about that part. Working part-time, finishing school, and giving you all the quality and educational material or content that I feel you all could benefit from. So if any of that interests you, if you aren't subscribed, go ahead and hit that subscribe button, hit the like, and share the video. Check out some of my other videos. I think you may find them helpful. Until next time, peace.